purpose of this really is to normalize therapy.
There is a misconception that if you have a mental health problem, you automatically have to see a psychiatrist.
Hey there, welcome to the Mindcare Podcast, a podcast on mental health matters. Hi, I'm JT.
And I'm Janine. Join us every Wednesday as we navigate through today's most relevant issues on mental health and wellness and help promote happiness in the world.
After each episode, our conversation continues on mindcareclub.org, where you can take the next steps in giving your mind the care it needs.
Now, welcome everyone to the very first episode of the Mindcare Podcast. In this special two-part episode, we had the opportunity to talk to the people behind Mindcare Club.
Please welcome our special guest, our Chief Medical Officer, Dr. Casimiro-Querubin, and our Chief Executive Officer, Dr. Platon.
Yay! Hello, everyone. Thank you so much for taking time today to be with us and to explain to everyone what Mindcare Club is.
Hello, JT and Janine. Hi, Mark. So I think both JT and Janine have some questions for us to address. So where do we start?
Dr. Mark, can you explain to us what Mindcare Club is?
Mindcare Club is a telemental health platform. Okay, so we conduct consultations with our clients and our patients using an online platform. Okay, so instead of pre-pandemic, how you would have to go to the clinic or to the hospital to get consultation with your psychologist or your psychiatrist, this time around we're doing it remotely. And I think by now, we're more than a year and a half in this pandemic. I think people have become accustomed to using the computer as a tool for medicine. And in this case, it's specifically for mental health.
Can you tell us why we started Mindcare Club to begin with before the pandemic started?
Yeah, not a lot of people know that Mindcare Club has actually been in the works for a couple of years now, even before the pandemic hit. And initially, it was really designed to be a brick and mortar clinic, meaning you would have a physical clinic. And originally, our founder, Brian Tenorio, had envisioned it to be a mall-based clinic, right? So, he wanted it to be a more relaxed environment as opposed to the white walls and the white coats that you'd see around in the hospital. So the purpose of this really is to normalize therapy. Here, especially in the country where, not a lot of people are that comfortable with the idea of, seeking help for mental health. So we wanted to, remove the stigma and make it normal for people and something that people are looking forward to doing. And more importantly, for people not to be ashamed of it. Mental health does not really necessarily equate to illness. And, it could be preventive as well. That was the original vision for it. And quite interestingly enough, this was partially in response when there was an alarming, not just the rise, but, news coming out of younger individuals who were in distress that they could not handle on their own. And I remember that back then we had this conversation with our high school teachers. Ryan and I have kept in touch with our high school teachers. They've become very good friends of ours. And they were sharing their concern with us, how there were a lot of children, a lot of students who were going through a lot, mental health issues, but they just didn't know where to turn to. And I guess the system they had in place at schools were there, but maybe it was not enough to address everyone's concerns. And so he wanted to step in and I guess provide a new venue where people could, easily identify that, okay, Mindcare Club. So this is a place where I can go to address my mental health needs. That's how it started and was a dream that he had. And fast forward, I guess, to the end of 2019, he had found a spot actually. But with Brian, he has always wanted to execute, his brilliant ideas right away. And he just could not wait for the physical clinic. So he said, okay, we're going ahead with plan B. So we're going to do the online clinics first. And that's what happened. And so by January of 2020, we had Mindcare Club online. And we saw our first clients, our first patients. And who knew that just 2 months after that, we were just thrust into this lockdown. I think we could not have come at a better time. We've definitely seen the impact that this pandemic has had, yes, around the world, but most especially around here in our country. We're glad to be around to people who need guidance and someone to be there for them during this very, very difficult time.
Thank you so much for that. We completely agree that Mindcare Club really has changed the way we are able to access mental health care. Because even if it weren't for the pandemic, having that accessibility within just a computer's reach is very impactful for people who, whether they have stigma of mental health or cannot go out, are embarrassed to show other people that they're seeking mental health. It's very important they have this access.
Right. And even before the pandemic or the lockdown, people already had fair share of concerns. It's not like all of this was caused by the pandemic. Yeah, and so everyone's going through something, and that's completely fine. I think it's encapsulated in Mindcare Club's mission. What we want to do, and that is just to help lessen sadness in the world.
Mark was correct when he was pointing out that the time that we were initially talking about Mindcare Club, there was really a sudden increase, or at least a sudden increase in concern about young people who are going through so much distress and not knowing what to do, and there's not enough help for them. So the idea then was to increase and improve that access by taking the mental health professional out of the hospital and closer to where the young people were. So our target area then was near universities and near high schools, so that the kids or the young people, the adolescents, can actually come and drop in, supposedly in an atmosphere where they will be more relaxed and feel less judged. But yes, one thing led to another. And one of the other things we wanted to address was the fact that there was so much traffic, and for people to actually reach their doctors or their psychologists, who were mostly based in hospitals, it will take like an hour to get to the clinic. You have to wait 30 minutes to an hour for your next session. You spend 30 minutes, 45 minutes with your doctor, and then you spend another hour going home. So it's like, technically, people were losing time, na stress na nga, and they're anxious, and then the traffic makes them more anxious, and then the return makes them more anxious. So we were saying, we have to do something about it. So the idea of using a virtual or online platform also came in. So those were two parallel ideas that were happening at that time. The brick and mortar or the physical clinic, we shelved temporarily, and Brian was of the idea na bilisan na natin. Let's just launch it and then try. So because the brick and mortar was going to take a bit of time, so we went ahead with the online. I think, Mark, you can address the fact that we're using a HIPAA-approved platform, so everyone is assured of confidentiality and privacy and security of data.
The platform we use is actually an international one, the same one that is being used for NASA. I think especially now we're in the age of information, and really people are very, very concerned about information security, the privacy of your information. These are very potentially sensitive matters, right, that you discuss privately with your doctor. So definitely that was a number one concern and consideration for us when we were setting up the online platform. And we found the best partner that we could find so that we could guarantee all our clients and our patients that they have nothing to worry about. They can come to Mindcare Club and everything is safe and secure. They can just open up freely during their sessions.
Yeah.
I see. So besides that, now we already talked about so many things about Mindcare Club. Can you tell us more about why someone would choose to go into Mindcare Club, and also introducing the first step?
Yeah, well, we do have what we call the care team. We're very, very proud of this team that we've built over the years. This team is awesome because when we were setting this up, we didn't want to just put out a platform where, like everybody can go online and basically just transplant their physical practice into the internet. We really wanted to build a community, and that's what we're so happy with. While we are assembling probably best minds in mental health care, we're also providing them with a safe space, a sense of belonging where they can grow in their practice alongside their colleagues. It's a good feeling, especially in these times, to feel like you belong, right, to something that's bigger than yourself, and you're all in it together for a greater good.
Maybe you could also talk about who usually avails of Mindcare Club. Do you have like corporate partners or organizations that use Mindcare Club?
It's quite an array of clients that we get. Initially, of course, we had just intended this for individuals. We call them retail customers, and the plan was just to simply have them access Mindcare Club through our website. But then, much to our surprise, we started receiving inquiries, from companies who were interested. I mean, not just local companies, but also multinational companies who were very, very much concerned about the welfare of their employees. And some of them, needed help in figuring out where do we begin, right? And so we can help them as early as policy making. And so we have a consultancy available for companies that need assistance in figuring out how they can be compliant with local laws concerning mental health, creating programs for their organization, and ultimately creating that link from policy to actual, intervention for people in their organization that might need it. So there really is also a thrust on education and information, because ultimately people have to understand first what mental health care is. So every step of the way, we want to hold their hands, and so that they don't feel afraid, that this is something that they have to do alone, or that there's something wrong with them. So those are some of our experiences with our clients, whether they're individuals or companies. Pretty much when people approach us, there is no cookie cutter formula that we will be handing them. It really becomes a tailor fit to help them get from where they are to where they would want to be in terms of their mental health.
Thank you, Dr. Mark Platon and Dr. Casimiro-Querubin, for sharing Mindcare Club's story with us. It's so nice to see how the dream of lessening sadness in the world is finally coming to fruition.
Indeed, lessening the barriers for every Filipino to experience mental health care is one of the things I really like about Mindcare Club's vision. So join us again later for part 2 as Dr. Casimiro-Querubin and Dr. Mark Platon share with us Mindcare Club's first step, the barriers to care, and more.
So don't forget to like, share, and subscribe to our YouTube channel. See you all later. Bye!